Hey everybody, welcome to the TEConnect podcast. I'm John Martin.
And I'm Dean Reverman.
Today we're going to be talking with Zebra's Chris Sullivan and BlueStar's Matt Jordan about artificial intelligence, machine learning, and predictive analytics in healthcare. As always, our recurring segments, the value to the VAR, and what's tech connecting with us. It's time to plug in and get connected.
Welcome to the TEConnect podcast. It's time to get connected.
All right, our guests today, as I mentioned, are Chris Sullivan and Matt Jordan. Matt, you might remember from the show before. He was on with Dr. Christine Perales.
He's been around for a while.
Yeah. We know who he is. We don't need to talk about him again. But Chris Sullivan is the Global Healthcare Practice Lead for Zebra. Chris, welcome to the show.
Thank you, gentlemen. Since I'm first-time guest, you have to be nice to me today. Go easy on me, okay?
We'll be nice to you, not so much on Matt Jordan, probably.
Yeah, exactly.
So we're good.
Exactly. Well, Chris, tell us a little bit about yourself. What is your day-to-day role like at Zebra? How did you get there? Where have you been?
So, John, my role at Zebra is the Global Healthcare Practice Lead. I primarily serve in two functions. One, I lead our healthcare strategy for our company globally. What technologies, what use cases, what markets should we invest in, should we build out? That's a big part of my role. And then I also spend a lot of time talking with customers, talking with industry leaders, and representing Zebra in the marketplace and events like this and many other types of events. I've been with Zebra for 5 years. Prior to Zebra, I had a long history in healthcare in a few key roles. Not only do I work for Zebra, but I also am a customer myself. I'm a board member of a large hospital. I chair the quality committee at that hospital. So I get to see firsthand how technology can make a difference in patient care impact and safety and quality. And I'm also a board chairperson for the Global Healthcare IoT Community, which is an organization that advocates and evangelizes best practice technology applications as well. So try to take those experiences combined with the Zebra experiences, and hopefully when we all work together, we're making a small mark on better patient care, better quality, and lower costs.
Awesome. Yeah, I think we've picked the right person then to talk about
these
particular topics. We were actually discussing just before you came on that we're glad we've brought an expert in because neither one of us feel like we're particularly, knowledgeable about AI and healthcare, machine learning. They're topics that I feel like are popping up a lot, but not something that we feel super comfortable with.
But I got to tell you, and it must be really frustrating for both you and Chris and Matt. It seems like everybody right now in general is a healthcare expert.
Oh, yeah.
Because we're going through this pandemic, everybody kind of feels like they know how the system works and they know how vaccines are created. And it's like everybody, I can just imagine, what you guys go through on a daily basis. Everybody thinking that they're the mechanic and that's got the fix maybe.
Yeah.
I don't know.
And you've got to be the ones to correct it all the time, I'm sure, too. Be like, well, actually, So.
It's not that easy.
Yeah, exactly. Well, again, we want to thank both of you for being here. We're going to go ahead and get started, jump into our topic. Again, we're talking about AI and analytics in healthcare. And I want to start off with because I know this is one of those topics where everything we're kind of going to talk about is all sort of part of the same story, but we're kind of going to try to break it up a little bit into what the different segments are and what they actually mean in healthcare. I want to start off with artificial intelligence, which I think a lot of people probably think of in like a science fiction context. You think of, Skynet ready to take over the world and destroy us with Terminators running around. Like it's machines gone wrong. It's people get scared about the idea of a thinking machine, and they think that can be a bad thing that might lead to bad things. But in actuality, there are a lot of amazing practical uses for it that can take us far beyond what we're able to do as human capabilities and how useful that can be. So, Chris, Matt, I want you guys to start off talking a little bit about how is AI currently being used in healthcare?
So AI in healthcare, John, is real and alive and active right now. It's the train's left the station. There's lots of good applications. It has tremendous promise and already in some areas is yielding good results. We're clearly in the early stages with it. but it's being used in a diverse amount of ways. It's being used in ways that are clinical, it's being used in ways for research, it's being used in ways for frontline caregiver productivity, patient interactions, operational functions of healthcare, many, many different ways. I'm sure Matt would agree and share some of the same sentiments.
Exactly, guys. Really, what I'm saying is it's a lot of data that's there. It's what are you doing with it, and how are we managing it, and trying to take a proactive approach to it. And Chris may dive a little bit deeper into some of this, just from personal experience, but from what we're seeing is a lot of different levels and workflows, not just segmented to just a single requirement or use case, but overall like administration, operational, clinical, surgical. So looking at ways to how can we predict no-shows? How can we predict appointment cancellations, for example? And that may just be one avenue that a health system looks to go to. Another layer could be from the operational side, how do I optimize staffing levels? You're seeing that right now, of course, addressing strains or constraints on in environments that I need to maximize and beef up those levels. How can I utilize some of those numbers and some of the information at hand? And then one of the last components was optimizing inventory. And of course, this is paramount. And if they weren't thinking about those decisions before, considerations into supply chain, movement of materials and goods and services, you better start thinking about it now. It's a quick wake-up call. And last was simply more from a clinical side, is at least just from what I've seen in my personal experience of working with some certain ISVs and partnerships. How can we predict a certain onset of a condition, be it diabetes or sepsis, for example, that some of these situations result in unfortunate circumstances, but if they're caught early, they're easy to treat. And so the key is how can we be more proactive as clinicians, improve some of the patient care and outcomes more in a proactive, timely manner. And that's where the numbers lie. And it's really just incorporating some of those platforms, utilizing a mobile device, for example, to receive those alerts in a timely fashion that indicate if you don't act now, the outcome is going to be a worse situation. And here's what you need to do from maybe predictive analytics and also prescriptive analytics.
And that's a good point, working it into the workflow, I guess, right, of the people that are actually doing the work, whether it's the doctor, whether it's the nurse, whether it's whatever it would be. To your point, Matt, it's data-driven, right? So we're getting the data, the analytics, the AI is manipulating that, but now how do we also get that information in the hands of those that can impact a workflow or an outcome or things like that, right?
Sure, exactly, Dean.
Yeah. Yeah. And do you feel like any of this, we've talked before, and certainly we're all being impacted by the pandemic that we're in right now. Talk to us a little bit about some of the acceleration that might be going on in some of these places, like, the use of our AI or these types of programs and things of that nature. Maybe they were on the board at one point in time, and we'll get to that in a couple years. Are you seeing some acceleration of implementing these types of things into the workflow and stuff like that because of the pandemic that we're in right now?
Dean, absolutely. The pandemic is accelerating innovation and use of technology in healthcare in many ways. One real clear example is in the application of telehealth and/or remote patient monitoring. Basically touchless patient care delivery, virtual patient care delivery. That has seen an explosion of adoption. As an example, the UC health system in California had 6% of their patients pre-COVID-19 that were involved in some type of telehealth application. Post-COVID-19 or in the midst of COVID-19, 50% of their patients are receiving that.
Wow.
So that's just one example. Many, many others. Telehealth is interesting because at first glance, it's just using regular technology that already exists, and legacy application wasn't that intelligent. It was functional and it was modern technology, but not really AI orientated. But we're now seeing AI applications go nested into telehealth applications. One example is the use of chat boxes or chatbots rather in telehealth applications, which really allows the patient to self-serve themselves to get informed and valuable information without a frontline caregiver being there. And really, that is triaging patient care. What the organizations need in this time of patient demand and capacity overwhelming is triaging, making sure there's quick, smart, intelligent ways to filter the right type of care to the right person. And chatbots are able to do that. That was a quickly launched application and a really good example of artificial intelligence making a difference right now.
That's fascinating because as marketers, we are involved in chatbots, understand the use of it, understand the artificial intelligence and how it can help on, the customer experience, if you will. We would refer to it in that way, but fascinating that, of course, it makes sense that they would be used in a triage type of environment. Totally understand where you're going with that, Chris, in helping to mitigate just the onslaught, the need to be able to triage people very, very quickly. Using AI I get it, an example of how that can be done.
Yeah, definitely.
Yeah.
It's funny. When I was doing a little bit of research around this, I came across a discussion about AI in relation to documentation and transcription, which is one of those things I had not given much thought to. And I actually kind of remember back in the day, I used to work for a textbook provider that made textbooks for the collegiate level. And at one point, there was a textbook we were selling about machine transcription and helping people, be able to quickly identify, what a doctor's orders that they've transcribed and, transcribe it over to something. And, at the time, the software bragged about being able to understand a lot of different, dialects and, languages and accents. And I have to imagine now that's even more robust than ever, that AI is probably contributing to that and helping understand, how people speak, what their mannerisms are, maybe how they might be shorthanding something and quickly translating that into the notes that go into a patient file. One of those things, again, I don't know if I really had thought about before, but realized that's got to be crucial for a doctor or a nurse or a clinician that's on the move to be able to provide some notes to a program that can easily understand what they're trying to say, take maybe the short, quick way they might spit something out and translate it into useful information. Matt, any other types of applications for AI that you've come across that have been fascinating to you?
Just really what Chris had touched on before, and just taking that a little bit further, because we're seeing that as well in that segment, the remote patient monitoring, telehealth, remote critical care. That is, and I'd mentioned this at one point, just seeing how it's not an official mandate, but if you will, but it's a social mandate, because you've seen it now require just the lack of physical presence, and how can I get around this? Not so much a workaround, if you will, but just the capability to still manage patient care, manage the clinicians, the patients, the residents, the proper treatment, but in so much that I'm now overcoming some challenges from this, like we've talked about in the past, of reducing PPE, trying to minimize some of the clinician exposure to the pandemic that's brought on. So how do we utilize technology? How do we use some of the current workflows around that, and then maximize some of that data, some of that historical key points to essentially just quickly do our job very quick to overcome some of the triage concerns.
And you mentioned a couple things, and I know it's hard to look in a crystal ball, but do you guys have a comment on where you see AI going to? Because the reason I ask is I read an interesting quote about what AI is, and somebody boiled it down to this: whatever hasn't been done. That's what AI is. So, a voice recognition, okay, you can already say, yes, that was AI, but that's so old school, right? Siri, everybody's got Siri now. But what hasn't been done? So where do you guys see AI in healthcare coming down the pipe? Chris, do you have some thoughts on, some things in the future that excite you about AI and where it might be applied?
I do, Dean. I think the concept of multimodal data, combinatorial data sets being looked at together, being able to look at patterns within that. So that can have applications in precision medicine and small molecule development to speed up drug discovery, drug development, but it can also have the same application operationally. Earlier, Matt talked about staffing and predictive inventory and resource consumption. And so the multi-data concept of looking at not just the conditions inside the four walls of a patient care organization, but looking at external conditions as well, whether that be weather patterns, whether it be pandemic conditions like we're in right now. It's fascinating. There's been some really impressive AI applications around predictive planning. So multi-data predictive leveraging is I think really powerful. The ability to detect patterns and to discern anomalies to those patterns via artificial intelligence far surpasses the capacity of the human brain. And I think there's just amazing opportunities to be coming.
Definitely. I want to ask a little bit about machine learning because it's one of those topics I feel it goes hand in hand with AI and yet is always sort of described separately. And I think, again, when I was doing some research, I came across things about using machine learning in drug discovery, clinical trials, how to personalize treatments for patients, figure out where diseases might exist. So, Chris, can you kind of give us a high-level view of what machine learning is and how it fits into the AI picture?
So machine learning is simply a non-human being able to observe activities and to be able to process that, store the data, and analyze it. So machine learning doesn't just mean a large physical machine. It simply could be software. It could be the chatbot application or the natural language processing applications that we shared earlier. But machine learning is the capturing and the studying of high volumes and high streams of data that happen. I'll give a couple of examples, one very large and one little tiny to kind of share the spectrum. A very promising and powerful healthcare application is machine learning in diagnostic imaging. So you look at CT scans, you look at MRIs, and machines, according to many studies, are already on par with healthcare professionals who have had many years of trained specialization in that field. So the ability to more accurately detect or potentially more accurately detect a breast cancer as a example, or Alzheimer's, early onset Alzheimer's. Not only is there value in early detection, but there's also value in prevention of false positives. There's an enormous amount of false positives that occur in certain diagnostic use cases where not only is there personal hardship to the person who's going through this process with the feeling they may have a life-changing condition, there's also an enormous amount of economic waste of going through tests and medications and additional processes. So machine learning around diagnostics is really powerful. A little example that's simpler but also very relevant is in the application of AIDC technologies. So Zebra Technologies spends a lot of time trying to improve operational workflow in healthcare. And so we've paired our machines, which is in one use case, it's a printer and a mobile computer. We've paired those together to be able to automate actions and activities. As an example, when a nurse is at a bedside with a patient and the script requires a blood collection, through those pairings, you can automate the printing of a specimen label and not only improve accuracy, but just save a couple extra steps in a nurse's workflow. So that's a small example. The imaging's a big example, and Matt's probably going to share others, but there's so many in between. It's just almost unlimited.
Yeah, Matt, dazzle us with your machine learning knowledge.
Exactly. To touch on and continue what Chris had said about what some of the Zebra devices and solutions out there is just really how can we communicate and automate a lot of the separate siloed components. In some cases, you hear about certain departments being siloed or the devices themselves, the workflows, but essentially equipping not only a device but an area, a clinician, a patient. well, be it some of the further on technology, RTLS, BLE, and some of the location services as well, to where are some of these items, where are some of these people, what condition are they in from a facilities maintenance standpoint. I've just gotten a directive to seek out a smart pump, for example. Okay, where is that? As a clinician, I don't need to spend an exorbitant amount of time now looking for that particular material. I need it quickly. You're reducing the amount of just walking steps and just time away from the patient, and just flat out just deficiency in the operational workflow. So it's just consistent visibility across all spectrums to be able to automate a lot of those workflows into just very minimal steps, if you will.
Are there any studies, or do you guys know or have any idea of, as AI and machine learning continues to be incorporated into healthcare practices, how much more efficiency will it bring to bear in the marketplace? I mean, is this going to represent 50% more efficiencies in 10 years? Or because I think we all take a look back at the healthcare system, and as I said in the beginning of this podcast, everybody's a healthcare expert. It's an extremely inefficient process. Well, I'm hearing a lot about the efficiencies here. I'm just wondering, how much efficiencies are we hoping to get out of AI and machine learning in the healthcare? Do you guys know? Or is it?
I'll share a few examples that are close to how our organizations work together, kind of building on what Matt was describing.
Mm-hmm.
We have one organization that implemented a clinical mobility solution, and that resulted in a 50% reduction in the walking steps of their nursing staff. And a typical nurse on a regular hospital walks close to 5 miles a day.
Jeez.
So to have that is very, very significant.
Mm.
A similar outcome was at a different health system organization where they had a 15% increase in nurses spending time at the bedside with the patient. So that is huge from a patient experience, quality of care. There is a RTLS solution that resulted in 8% improvement in the operating room turns, the transition between one procedure to the next. And 8% doesn't sound like a gigantic amount, but it actually added up to $970,000 of operating expense reductions over the course of 12 months for this hospital.
Wow.
So there is really a lot of dollars here.
Mm-hmm.
And already we have some strong evidence points behind that.
Mm-hmm.
Yeah, definitely. Matt, you kind of mentioned a bit earlier about siloing in healthcare, and it's one of those things that we always talk about as being a bad thing in any business, like where you have siloed departments and groups that just aren't communicating and working together. I have to think in healthcare that's even more critical not to be siloed off from one another, and especially, again, during a crisis like a pandemic where, let's just say just a simple test, taking the test for someone for COVID-19. If you're not getting that information quickly enough to the lab, if you're not properly attributing it and identifying it to the right patients, if you're not testing fast enough, if you're not getting those results back fast enough, that is a lot of potential exposure and risk and potentially life that can be lost in a very short window of time if you're not getting that done quickly. So I feel like that's one of those examples where AI and machine learning and these predictive analytics are really kind of moving the mark and making sure that lives are saved. And right now is the time when people have to look and say, because we have this kind of stuff in place, or because we're implementing this stuff right now, this is how we're saving lives and preventing the spread of a deadly disease at the moment. I kind of want to wrap this part of the conversation up by talking a little bit about those predictive analytics. Matt, you kind of talked a lot about this actually up front about some of the use cases that are out there, getting that kind of operational data to identify like at-risk patients for sepsis, diabetes, improving where there's cancellations and no-shows. I did a lot of research about that recently for a marketing project and found it fascinating that, we could just figure out what kind of patients were not going to show up based on maybe their age group or their marital status. I think single people were less likely to or were more likely to cancel or not show up for an appointment because they don't have the same support system as someone who's married might be. Younger people might not show up because they feel, a little more invincible and invulnerable. They're not concerned about their health as much. So I kind of want to ask you guys to tell us a little bit about what else can we learn from predictive analytics. I mean, obviously it seems to be just about taking data that already exists that's probably somewhere stored, but finding the right ways to collect it and figure out what to do with it. So what else are you seeing? Matt, I'll let you start on this one.
Yeah, really, John, you touched on it. It's not to say that you're having to find new ways to start this from scratch, if you will, but just the data is there. The EHR, the EMR is capturing this in real time. A lot of the data points, the key historical features. You've got a lot of data sets to be able to look back through just from a particular health system that says, hey, let's look back, 5, 10 years, 15 years or so, and look at certain patients that exhibited certain conditions. What were some of the key attributes there? And so the data has been there, it just wasn't used. And so now it's been a quick surge or higher demand to analyze that data. And of course, there's a bit greater technology to be able to extrapolate that data as well, get it to yourselves quickly, analyze it quickly, and then say, what do I have in front of me? What do I have in my hand? So I think just like you had touched on before about timeliness, a lot of this with, and I think the pandemic has driven it again with the wake up call, but also then going to what you may see as some of the more routine workflows that will exist. Thanks to the wake up call, healthcare will change from here on, where you'll see different segments of priorities now shift that weren't there before. But essentially, again, really just saying it's the data itself is not new technology. It's just taking that some of these platforms that some of these partners that are out there. There's a good amount of analytics companies that are there that may support different applications and strengths. But again, it's just trying to get a health system to look at it and say, what do I do with this? Mm-hmm. It's there. How do I dig it up? How do I make it more efficient for my staff, for myself, for my decision making, ultimately for my patients? How do I reduce spending, waste? How do we optimize from that point on? So not reinventing the wheel per se, but just utilizing what we've got and then just pulling it out and then aggregating it, crunching the numbers, and then making those decisions based on what's been shown to you.
Definitely.
And, I think, Matt, we've also talked about tying in external resources too. So maybe it's not within the legacy system itself, right, or the healthcare system itself, but you've tapped into partners that can tie in such things as weather data or traffic data, as it relates to cancellations and no-shows, and using that into the analytics pie, if you will, right? Is that where you were going with the partnering type of aspect?
That's a good segue into just, and that really goes outside the realm of healthcare if you think about it, definitely outside the four walls, but it's not looking at and analyzing what do I have inside my health system, inside the four walls, inside my surgery centers, for example, my long-term care facilities, but you could really run this thing even further, like you said, of just analyzing population and demographics in certain size cities, weather patterns becoming just more prevalent during a certain time of year or a certain climate that will definitely now affect when and how folks will show up just based on appointments, for example. So you can really get and stretch and reach and get pretty far with some of this data. The more you want to include, the better, and that'll enhance your outcomes and your decision making.
Well, this has been a great conversation about AI, machine learning, predictive analytics in healthcare. It's probably the kind of thing we could talk about easily for a very long time, and maybe we'll bring Chris back on to discuss a little bit further or dive into some other topics. But we do want to move into our recurring segments, which is the value to the VARs and what's tech connecting with us. We'll start with that VAR value piece. I want to ask a little bit about the implementation process for AI and analytics in healthcare. I know it's a very daunting, massive process. It's not something that health organizations can just decide to do overnight and the next day they're up and running. It takes a lot of time. It takes a lot of research, a lot of thought, a lot of money, a lot of input, a lot of discussion with decision makers. So for our VARs that are out there that want to become part of that process and make sure that they're there to help out when they need to be, how do we think they fit in? How can they stay involved? What kind of questions they should be asking? Chris, I'll let you start. Where do our VARs get involved with AI?
I also think the VARs have a really important role, and I think it's an excellent opportunity for the VARs. So I think on the front end, I think looking for opportunities, looking to shift conversations away from a product and into an improved workflow. And so being more open-minded with the possibilities of AI and the AIDC solution set. We shared some really good ones today. So I think there's definitely a opportunity to uncover new business possibilities and to change the mindset of the customers. Sometimes the customer's paradigm is not reflective of the potentials of artificial intelligence. And then I think once you go through the stages of customer business development, I think the VARs really critical all the way through, and especially when you get into implementation, planning and providing structure to the implementation and providing process excellence around that. I've seen many a times firsthand how that makes a difference, and I've seen how it commands customer respect and attention, and that's established.
Definitely. Matt, what about you? Where do you think the VARs fit into this process?
Yeah, I think it's the VARs. Really, best intention is to act as a consultant, a confidant in something like this. That's definitely probably a larger scope than some of the things they might have worked on in the past. This is in some cases well above and beyond some AIDC applications. So, but granted, a lot of it is related. So it's how can we analyze some of the health system's technology infrastructure? Are they capable of implementing something like this? Is this a direction that the health system wants to go from an analytics standpoint? Can we utilize and repurpose some of the existing technology, or understand, hey, here's a gap where in order to run this route, you may have to be considerate of this and additional spend, additional workflow, additional technology pieces. Are you ready for this? Do we have sign off on this and really just an agreement of looking at what you want to do? And have they analyzed some potential points where here's where we could improve clinical efficiency, operation room turn times, things of that nature, where are you looking for certain areas to improve upon? What are those? And come up with a short list of quick, easy places to navigate and to hit and to focus on. And that's where then the analytics piece can then come into play to solve some of that. But really, it's from the VAR standpoint, it's diagnosing, it's asking questions. It's obviously just no doubt getting deeper with some of your existing clients or net new business of what are they looking to do? What's your strategy now? Not even pandemic related, but just what were you thinking about even doing beforehand in the next few years in order to implement some of this new solutions and technology.
Yeah, I think that's really good, Matt. And the value to the VAR to me is, if I could sum it up, and I keep thinking about this, especially as, when I came from the reseller world, and even back then, our company thought about the term intellectual property. And so I know a lot of AIDC resellers are out there, and a lot of them have a certain amount of intellectual property that they're bringing to the marketplace. It could be a widget, a software widget that they've developed or something along those lines. Think about how you can build off of your own intellectual property. If you already have it, it's probably not as hard as you think to get into the AI game. I was reading an article where the quote was, a surprising amount can be done with a small team. So if you have a small team that can maybe augment your engineers in a way that's in the AI field or the analytics field, I think they would be surprised at how much they can do and add to their intellectual property just by taking a small step into that. And then, as we've always talked about here, it's your ecosystem, right? The value to the VAR is making sure that you can leverage the ecosystem that you had. To Chris's point, the reseller is very integral into this process, and the better ecosystem, the more that you can leverage those partners within your ecosystem, the better, I think, along the
definitely.
way. Yeah.
We admitted up top of this show that we're not particularly experts in this, and
right.
I think we may know a little bit more than we did to start, but still far off. And I have a feeling it's a lot of our VARs feel the same way, that they probably go in and think, man, I'm not super
I think
confident
so,
about
right.
this technology.
Yep.
So, maybe it is about, going out and doing your research yourself. Again, as you mentioned, partnering up within your ecosystem, finding out who's someone out there that can teach you more about this and help you go in and have an intelligent, thoughtful conversation. And Chris, back to your original point there is I think, feel free to be proactive. Don't be reactive to the situation. Don't wait for someone to come to you and say, hey, we're starting to implement this stuff into our organization. How do we do it? Go to them and start having that conversation from the beginning and make yourself part of it so that when they are ready and when they do get there and they're reaching that point in the process, they immediately think, hey, I'm going to go to XYZ company because they've already been talking to us about it. They've been asking about it. They seem like they're ready to get involved.
Yeah. Yep.
So.
True.
Well, our other question is the fun part of our podcast. What's tech connecting with you? This is where we go around the horn and we talk about one or two technologies that are exciting, impacting us right now. Doesn't have to have anything to do with what we've just talked about. It just could be something fun that you're reading about, something you're using, something you're playing, something you're listening to. Just what's grabbing you?
Matt's already answered this question, so he can't answer the same way, right?
That's true. It's got to be a different answer. So hopefully, Matt, you've prepared a different answer. And I'm going to put you on the spot first and ask you, what's tech connecting with you?
Funny guys. No, something cool I saw like this a number of weeks ago. What was just the taking really virtual reality. The headset or the device itself that I think some of us have gotten the luxury of looking at and just placing yourself in a virtual environment, which I thought was really cool. But the neat thing of just where this is going is just that it's tied in from a medical standpoint. Taking it and utilizing it for patients to minimize the stress, the anxiety, of course, in a surgical procedure, for example. The patient is literally wearing this device. They're presented with an attractive, comfortable environment that they're in, or they think that they're in, of course. And this is really shown to reduce the length of the surgery and also reduce the amount of medication needed in a sense of anesthesia, for example. So now you're minimizing that, you're minimizing the cost, but it was just a neat use of technology that you would really think, wow, hadn't things connected in that way in a useful case to it.
Yeah, that is fascinating. That's pretty good.
Matt, you bring the serious stuff to us. I like it, but it's good stuff. Chris, what about you?
Guys.
What about you, Chris? What's tech connecting with you right now?
Well, I have a fun one and also a serious one. I'll try to squeeze both in. So yesterday was my birthday.
Oh, happy birthday.
Happy birthday.
Thank you. Received a portable stereo that can be wheeled out into the backyard and is Bluetooth paired. And it has basically amazing sound quality and was able to just light up my backyard. Yesterday we had a little birthday celebration. We put in a pool. And so we now have this rocking system to enjoy, hopefully, nice times in the backyard in the summer. It's just amazing the quality of sound that can be displayed mobily and through smart technology. So that's very fun. And
hey, Chris, though, is it a karaoke too, or is it just a sound system? I didn't know if we're coming over to Sullivan House for a little karaoke at night.
No karaoke. That was the add-on feature that we didn't get.
Right.
All music is karaoke music.
That's
if you
true.
Make it
That's
that
true.
Way, though.
That's true.
So,
there you go.
That's right.
The biggest concern my wife had was that we're going to agitate the neighbors, or more specifically, I'm going to agitate the neighbors by playing the music too loud because the thing just cranks so loud. So
I was just going to say you're
that
guy.
Yeah, that guy. Right.
Well, we'll keep it under control.
There you go.
All right, what's your semi-serious tech connecting?
Well, we're all challenged with these super difficult times, and we're trying to balance safety and health with economic impact and job and income. So Zebra just last week announced a really impressive solution around contact tracing, where you're able to pair people together and to make sure people keep appropriate social distance. And if two people are Zebra enabled, they'll get an alert if they cross into unsafe distancing measures. And then at the same time, that will also allow people to capture and monitor who they are interacting with within those short measures or unsafe measures. So it's a tracing system with intelligence and trackability of the people coming and going. And that has healthcare implications, certainly inside hospitals. We're talking to some very large healthcare organizations about that, but it also has implications in manufacturing environments, talking to major auto manufacturers, food manufacturers, and it really feels like it's going to help get America back to work in a way that's safe and efficient. So really excited about that.
Well, that is a timely technology, if you ask me. Absolutely, yeah.
Definitely.
I mean, the implications are dramatic and immediate on that front.
Yeah,
no doubt.
definitely. What about you, Dean?
Well, I don't have one as serious as that, but I know we've all been enamored by this. What's tech connecting with me is space and getting back. Oh, were you going to go there too?
I thought about it, but I figured you would do it, so I decided to pick something
all right.
else.
Well, so what was fascinating to me, though, about the recent launch back into space with NASA and SpaceX was actually the Dragon capsule. So I was fascinated by the inside shots of what the capsule looks like right now. Dude, do you realize, I mean, if you're an astronaut, you basically have 3 touchscreens in front of you, and that's driving everything. You don't have the space shuttle of 5,000 knobs and thrusters and knobs here, buttons and stuff like that. So cool on the inside, right? I mean, that was like the coolest looking inside of a capsule that I've ever seen. So yeah, apparently you just need to hit the touch screen and you're good to go.
Yep.
And the cool spacesuits. I mean, the whole thing was like, that's pretty darn cool.
It feels like the future of space travel has actually arrived. What we always see in the science fiction shows, like we're kind of there now. You know, we're closer than ever to Star Trek. You know,
I have faith that I might have my Jetson vehicle here before I die.
Yeah, you keep dreaming about that one. Remember we talked about autonomous vehicles before. We're nowhere close to that.
No, we're not. What's up with you, John?
So for me, I'm going to go a little bit retro and old school and nostalgic. A lot of people love to play video games, and I keep hearing people talk about gaming during this time when they've got the free time. First of all, I don't know where that free time comes from, but we've been lucky people that we get to keep working and doing our day jobs here during the pandemic. But I did dust off recently my Super Nintendo Classic. A few years back or so, Nintendo released classic mini versions of the original Nintendo system and their Super Nintendo system.
That's right, I remember.
30 games on each one.
Yes.
They look and play and feel just like the old school. Even the aspect ratio on your television is the way it used to be. It doesn't fill out a widescreen. So I recently kind of started breaking it out and played it again. It was one of those things I brought it downstairs and plugged it in and thought, well, I'll get to this when I have some time. Well, my son...
And then Miles came in the room.
Yeah, he's 2.5. He saw it and was like, what's this? And he very quickly kind of got what it was, that it was a gaming system of some sort, which fascinates me. And he loves to ask me to play the games. Like, he can't do anything with them right now. He has no coordination for that.
Oh, but he likes watching you.
Right. But he insists on having a controller.
Darn, Dad has a reason to play games
exactly.
now.
Like, all right, son, sure, I'll plug it in and play some video games for a couple hours. Like, I'm doing it for the kid, you know.
Right.
So, yeah, I've very much been enjoying, getting into some of the old games, like Legend of Zelda, Mario, Street Fighter, just the stuff I played when I was a kid.
Right.
And now I get to do it again, and my son seems fascinated with watching
enough.
it. He gets bored quickly, but that's fine. He wanders off and does something else, and I play for another hour and pretend like I'm still entertaining him. So.
What's old is new.
Exactly.
There you go.
So that's what's tech connecting with us. We want to, first of all, thank our guests. Chris, Matt, thank you so much for coming today. We appreciate
Thank you, gentlemen.
Thank you, guys.
Definitely.
Thank you, Chris.
It is time for us to unplug. I do want to let our listeners know, though, if you have any thoughts or comments about AI, analytics, machine learning, and healthcare, if you want to tell us what's tech connecting with you, first of all, you can reach out to us on Twitter. That's at TEConnectPod. You can email us, techconnect@bluestarinc.com. And hey, we've been going at this for long enough now. Go to Apple Podcasts, leave us a 5-star review. Tell us what you like about the show. Ask us a question. We'll maybe try to get to those on air at some point. We'd love to hear from you.
Yeah.
So, again, it's time for us to unplug. For Dean Reverman, I'm John Martin. Until next time, stay connected. The TEConnect podcast is brought to you by Zebra. When was the last time you discussed upgrading Zebra products with your customers? With a bevy of new releases spanning their entire portfolio and the shift to Android as the enterprise OS of choice, there has never been a better time to discuss upgrading and refreshing.
To help you figure out where to start, BlueStar has reviewed your unique sales history for Zebra technologies, identifying every opportunity to refresh your customer base. Mobile computers, scanners, printers, tablets, RFID, even services and supplies, BlueStar and Zebra have you covered down to the original PO number.
Don't be the last VAR to talk to your customers about upgrading. Contact your BlueStar representative today to request your Zebra Refresh Report.